Good afternoon, good evening, or good morning. Katania Alvin, Part 4 on smart meters and the EMR, the health crisis of our time. And this is continuing with Dr. Dietrich Klinghardt. Wonderful man. In this fourth part of the video, he talks about the neurological disease is exploding in exponential increase due to the exposure of man-made magnetic fields. Neurological diseases such as Parkinson's, MS, ALS, autism, learning disabilities in children is all exploding exponentially, he says, and the only thing that fits from the environmental perspective, from an epidemiological perspective, is that this is an electromagnetic waves that are penetrating our body that are responsible for this over the past 80 years. And then goes on to, and you'll hear, over the past 80 years, over 6,000 studies have been published on the biological effects. The majority of these studies have shown biological damage being done. One notable study, which was published just before this film was made in 2012, from the University of Athens, over an 8-month period, showed 143 proteins in the mammalian brain were altered after exposure to a mobile phone or a DECT wireless base. Okay, we'll go on with listening to him.
Infection, chronic parasite infestation, those things have been extremely rare when I graduated from medical school, and now it's our everyday discovery. Our patients are chronically ill that they have these things. And so when we look deeper, what is it that has changed in the last 15, 20 years that these chronic infections have become so prevalent? And what we discovered is very simple. It's the exposure to electromagnetic fields. The only thing that parallels the exponential increase in in chronic neurological illness, with the low-grade depression, the insomnia, the muscle aches and pains, and the fatigue, and the strange neurological symptoms with tingling, numbness, vibration in the body. That increases exponentially. The number of children to be diagnosed autistic doubles every 5 years now. There's no more an issue, well, are we overdiagnosing it? No, it doubles every 5 years. The only thing that parallels that increase is the increased exposure to man-made electromagnetic fields, largely in the high-frequency range.
Okay, I think I've done an overlap here. That's fine. And now from this point, which is 649.
There's some exceptions that have also increased, but largely is the high-frequency range from cell phone radiation, from the Tetra network.
That's from the cell phone radiation, from the Tetronic work, he said, I think.
Police and other systems are using the smart meters.
Oh, that he said that the police are using the smart meters.
Are the worst invention.
Are the worst invention. Smart meters are the worst invention.
That we followed in the last 2 years. There's absolutely devastating consequences that I will share with you.
Impact of radio frequency electromagnetic radiation on DNA integrity in the male germline. That's on the DNA in the male germline.
The only development that parallels the exponential increase that we observe in neurological disease is the exponential increase in exposure to man-made electromagnetic fields. So as a scientist, we don't have to look very far, but neurological disease, Parkinson's, MS, ALS, autism, learning disabilities in children, behavioral problem in children, that's all exploding exponentially. And the only thing that fits from an environmental perspective and from a epidemiological perspective is that this is the electromagnetic waves that are penetrating our body that are responsible for this. And fortunately enough, we have good science now.
Over the past 80 years, more than 6,000 research studies have been published on the biological effects of electromagnetic radiation. The majority of these studies have shown biological damage being done. Of the many more recent advances in research, one notable study was published earlier this year by the University of Athens. The results over an 8-month period showed 143 proteins in the mammalian brain were altered after exposure to either a mobile phone or a DECT phone base, including proteins which have already been linked to Alzheimer's, glioblastoma, stress, and metabolism. Lead author Adamantia Fragipoulou states, "The study is anticipated to throw light in the understanding of health effects like headaches, dizziness, sleep disorders, memory disorders, brain tumors, all of them related to the function of the altered brain proteins."
This permanently destroys and alters the manufacturing of these proteins, meaning it completely changes the human organism permanently. The DNA inside the cell is a booklet, an instruction booklet, how to make proteins. And we have about 120 to 200,000 different proteins that are in the cell or in the cell wall. The receptors, how the cell wall communicates with the outside environment is through proteins. And inside the cell, the manufacturing that each cell does of antibodies, of neuropeptides, of hormones, of cholesterol, of building blocks that the body needs to replace, used up body parts, that's all done by proteins. Even the physical structure of your body changes. We've seen a host of people that had normal body weight for 40 years or 50 years, and suddenly their weight exploded when the phone company put up the cell phone tower 200 yards from their house, not even that close, 300 yards from their house. We've seen the cancer rates shoot up the moment the network of cell phone towers was established in the house. We had a co-worker with us who had a son who was very, very sensitive to electromagnetic fields, and she lived here in Seattle, and he couldn't go to school because the schools at the time already had wireless installed in the schools, and he couldn't tolerate it. So she moved to Portland and then couldn't tolerate it there at all. Then moved over to Ashland, which claims itself to be one of the greenest cities in the world. And then when she Googled the cell phone towers next to the home that she had rented, she found that within 200 yards she had over 90 cell phone installations that were broadcasting into her home, and her son was virtually going nuts. And then she moved out in the country, decided on homeschooling, and the boy's been doing well ever since. So after observing like some very sort of very clear-cut clinical situations where people were affected by the nearby cell phone tower, we became very meticulous in asking people about their homes and looking at the literature. I got certified in building biology, which is the sort of science in Germany that governs these issues, where we learn how to use different instruments to measure these phenomena in the house. And the first thing that we noticed is that the most important time in the day when we are vulnerable to the influence of incoming cell phone radiation is the nighttime, when the parasympathetic nervous system is active and the sympathetics are withdrawing. That's when the damage is done.
Going to have to stop it there. Amazing information. This is so amazing. Share it out with as many people as you can. God bless. This is Katania Alvin. This is part 4, and I'm going to do a part 5.